The traditional model of patients learning about treatment options has been through brief explanations from doctors during time-constrained appointments, supplemented by whatever information patients could find through internet searching. AI is disrupting this model in ways that could either enhance shared decision-making or create new problems around inappropriate expectations and requests. On the positive side, ChatGPT allows patients to explore treatment options in depth at their own pace. Someone diagnosed with a condition can ask about different therapeutic approaches, understand what each involves, compare side effects, learn about success rates, and consider how treatments fit with their lifestyle and values. This preparation enables more informed participation in medical decision-making. Instead of passively accepting whatever their doctor recommends, patients can come to appointments with educated preferences and thoughtful questions. Cost and logistics information is particularly valuable because physicians often don't discuss these factors adequately. Doctors might recommend a treatment without mentioning it requires twice-weekly infusions for 6 months, something that could be impossible for someone with limited transportation or a demanding work schedule. AI can surface these practical considerations that affect whether treatments are actually feasible for individual patients, not just whether they're medically appropriate. The ability to understand risk-benefit trade-offs in detail helps patients make values-aligned decisions. Medical decisions often involve uncertain outcomes and competing priorities. AI can help patients think through scenarios like, would I rather have a treatment with higher cure rates but severe side effects, or lower cure rates with milder side effects? These are ultimately personal decisions that depend on individual values, and AI can help patients clarify their own preferences. However, this increased access to treatment information creates significant potential problems. Patients might develop unrealistic expectations about what treatments are appropriate for their specific situations. AI provides general information about treatments, but treatment appropriateness depends on individual factors like other health conditions, previous treatments, genetic markers, and disease stage. Someone might learn about an advanced therapy and demand it even though it's not indicated for their specific situation. The phenomenon of patients requesting inappropriate tests or treatments based on internet information already frustrates physicians, and AI might amplify this. Someone with a headache might learn about advanced imaging options and insist on an MRI when clinical judgment says it's unnecessary. This creates difficult conversations, wastes healthcare resources, and can lead to incidental findings that trigger unnecessary follow-up testing. AI might also present treatment information without adequate context about evidence quality. Not all treatments have equal scientific support. Some are well validated by multiple rigorous studies. Others are preliminary, based on weak evidence, or only work in specific subpopulations. AI might present these with equal weight, leaving patients unable to distinguish strong from weak evidence. Commercial bias is another concern. If AI companies partner with pharmaceutical companies or healthcare corporations, treatment information might be subtly skewed toward expensive branded drugs or proprietary therapies when cheaper generics or conservative management would work equally well. Even unintentional bias could occur if training data overrepresents certain treatments because they're more often written about. The solution requires AI systems designed specifically to support medical decision-making with appropriate guardrails. AI discussing treatment options should clearly indicate which treatments are typically first-line for various conditions and which are reserved for specific circumstances. It should present information about evidence quality and help users understand the difference between well-established treatments and experimental approaches. Integration into clinical workflows is essential. Rather than having patients arrive at appointments with AI-generated treatment opinions that they've formed independently, imagine AI-assisted decision aids that patients and physicians review together during appointments. The AI provides information structure and patient-friendly explanations, while the physician provides clinical judgment and individualized guidance. This collaborative approach leverages AI's strengths while maintaining professional oversight. Value-based information, including cost-effectiveness and quality-of-life impacts, should be part of AI treatment discussions. Healthcare spending in the U.S. is often divorced from value because patients don't see direct costs and physicians don't always consider financial impacts. AI could help make these considerations more transparent, supporting better individual and societal resource allocation. The key principle is that AI should enhance, not replace, the clinical decision-making process. It can make patients better informed and more capable of shared decision-making, but treatment decisions should ultimately involve professional medical judgment applied to individual circumstances, not just AI-facilitated research by patients.